Welcome to BPS Live. My name is Steve Ronan, and I'm a plastic surgeon here at Blackhawk Plastic Surgery. Tonight, we're going to talk all about breast augmentation. We're really excited to have you here with us. And welcome to my guest host, Brett.
Hi, thanks for joining us tonight, you guys. Dr. Ronan, that was a great first show we had last time. It was so much fun. Great feedback we got too.
We really want to make this an interactive experience. So if you have questions, please put them into the chat. And also, if you have any suggestions of future show topics, we'd love to hear that too. We want to make sure we're meeting all the things that you might be interested in. So let's get rolling with our first segment. Let's talk about breast augmentation. That means making the breast bigger. And most commonly, that's done with an implant. Occasionally, it's done with a patient's own fat. Implants today are typically either silicone or saline. In our practice, we're using the vast majority silicone. We find that patients like to feel better and look better of the silicone implants over the saline. With an implant, you can pick essentially whatever size that you want. Important is picking a size that matches the width of your chest. If you pick an implant that's either too small or too wide, it kind of sticks out and looks less natural. If the implant is around the width of the chest, then it sort of blends in and looks more like it was born there. With fat grafting, we can only move a much smaller amount of tissue. It's a little less predictable on how much that's going to be or how much will survive long term, but definitely the result with fat grafting is much more modest. Let's talk about what approach we use to get the implant in and where we might put it. So typically implants will go behind the chest muscle or on top of it. And so our preference at Blackhawk Plastic Surgery is to put them under the muscle. And we find that that leads to a better long-term result and less problems with the implant. The three most common approaches would be around the nipple, in the fold underneath the chest, or in the highest wrinkle in the armpit. We use all three of them, but the most common one in our practice is through the armpit. And the reason why patients choose that more often is they don't want a scar on their breast. The scar in the armpit really blends into the wrinkle and in many cases disappears. There's less sensation loss because the implant goes directly under the muscle and doesn't have to transverse where the nerves are going to the breast. In addition, when we do it transax, we don't have to cut your chest muscle. And so your chest muscle acts like a sling, holding your implant up against gravity over time. When you cut this muscle, the implant slides downward, and the weight, which is what an implant is resting on the breast tissue. And gravity is going to want to pull that down and out much more quickly than it will if the muscle is supporting the implant and it has nowhere else to go but stay right there into the muscle. So all implants have a similar external shell made of the same substance, but internally they can be filled with silicone gel or saline. In our practice, more patients, 99% or more, choose silicone. And that's because they just feel better, they have a more natural feel, and they show the side of the implant less, they look a little bit more natural. Saline implants are fine. They're filled with water. They do feel more like a water bag, and you can kind of see the side of the implant more than with the silicone implant. Both implants are perfectly safe. If they pop on a saline, it's called a deflation, and you absorb the water. If it pops with a silicone implant, it's called a rupture. The new implants, new meaning 20 years or more new, the implants are semi-solid, and they have different terms for each company has a different term for their semi-solid implant. But basically, if you cut them in half, they sit in two pieces. So they don't run. So if it pops, it kind of all sticks together, but then the implant will sort of get an odd shape over time. Let's talk about both the shape and the surface of the implant. So surface-wise, it can have a smooth surface or it can have a textured surface. It can be a round implant or it can be a shaped implant. Let's talk about shaped implants and why I really don't like them very much at all. This textured surface is there to hold the implant in a certain orientation. For example, if the shaped implant was to rotate a little bit, it would look very odd. So the body grows into the surface and sort of holds it there. This particular implant's been taken off the market because there's been a lot of trouble associated with having textured implants. We're not huge fans of them. In order to hold this shape, the implant's quite a bit more stiff. And so it just doesn't feel that good. It feels a little stiffer. And the implant is always the same shape no matter which way your body's laying. So for example, when you stand up, breasts are more teardrop shape, and when you lay down, they're more round shape. The stiff shaped implant is the same no matter which way your body's laying. On the other hand, the smooth round implants are much softer, they feel better, and they're also a more natural shape. When you look at an implant with the patient standing, it naturally with gravity becomes teardrop shaped. And when you lay down, it naturally turns more round, so it behaves much more anatomically or more naturally than shaped implants. Well, now you've come to the day of your breast augmentation surgery. Let's talk about what's going to happen. You'll show up here in the morning, get checked in, and we'll get you prepared, come back to the OR. You'll go to sleep. The procedure is well under an hour. We'll typically put the implant in through an incision in the highest wrinkle in your armpit. It'll go underneath the muscle. We'll wash the whole cavity out. And then as we're closing, we'll put a 3-day numbing medicine around the implant and the incision. The 3-day numbing medicine really kind of blunts down the pain so you don't feel nearly as much. When you're done, you'll hang out for about an hour. You'll be able to walk to the car and have your family drive you home. We'll see you back in 1 week, at which point we'll start teaching you how to do a massage and how to maintain your breast augmentation for the long term. You can begin going for walks fairly soon after surgery. After 2 or 3 weeks, we can resume low impact aerobics. That would be things like a treadmill or an exercise bike, but not really any straining. We'll wait 6 to 8 weeks before we begin more strenuous exercise, and then hold off even a little bit longer for chest exercises. The vast majority of patients can return to work within a week and oftentimes shorter than that. Patients that work from home often resume work the following day. Let's talk about some of the more common risks associated with breast augmentation. There's more general risks like having anesthesia or an infection or bleeding after surgery. And then there's more specific risks to the implant. And those would include things like a deflation of a saline implant or rupture of a silicone implant. If that were to happen, we would just need to change the implant out. Implants can also move or become asymmetric because of changes in the pocket. And another type of change in the pocket would be if it started to shrink, which would make the implant feel more firm. All of these are things that are typically handled with either some massage, medication, or another surgery. This patient is one of the first breast augmentations I did in my practice, going back about 20 years now. And it's the most common patient that we use to size people. Why is that? She has a size that most of our patients want. It's just a nice full augmentation, but it's not crazy or obnoxious. It's just like a nice solid augment. And almost everybody coming in wants around this or a little more or a little less. And so it's a great place for us to start when we talk about what size or proportion do you want to be. Her implant's under the muscle, it was placed transax, has a nice, normal, natural look. If you look at the width of the implant, it matches the chest wall, and that's a lot of the reason why it has that look. Let's talk about cleavage and how you get it and how it's built. It really depends on where your chest muscles originate off your sternum and ribs. Some people are very close together and other people are pretty far apart. So in this first example, you can see in the before where her muscles are very close together. And then in the after, it matches up. So her cleavage is pretty tight. In the next patient, you can see that the muscles start much wider across the sternum and ribs, and therefore the implants will sit a little bit wider apart, but look very natural. In this next patient, that's sort of a more normal width of the chest muscles and more normal amount of cleavage. So you're born to have a certain amount of cleavage, and you kind of need to go with that when you do an augment. If you were to take the wide patient and move the implant all the way in, that would rotate the nipples outward and have sort of an awkward appearance. And so your body, each person is designed to have a customized look, and we work with that to create a nice appearance out of each particular body. For the last few decades, I've done tens of thousands of surgical procedures, and one of the most common ones is breast augmentation. If you're interested in learning more about the specifics of you're welcome to come in for a consultation. We'd love to see you. We have a 13,000 square foot facility. It's beautiful. We have our own private OR with an anesthesiologist. And if you have any questions at all, put them in the chat and we'll get right to our Q&A section next. All right, time for some questions. So we have questions that were taken from some patients in our office, and we also have some questions coming from the chat. Brett, what do we got for our first question?
Yeah, great. Well, let's start with Kylie. Do you build an internal bra when performing a breast augmentation?
Kylie, that's actually a really good question. And so if you remember from the segment where I said we don't cut your chest muscle, so it acts like a sling, which will hold the implant up. If we do that, we don't need an internal bra. The reason why you hear about internal bras is because when you cut the muscle, it allows the implant to slide down. And so you're looking for some sort of a support mechanism. The best way to provide that support mechanism is just leave the muscle intact. And so that will provide your support mechanism. And therefore, you don't need to add an artificial internal bra.
I love that. I actually had a question very similar to that today on the phone. I have a question from Dana. Will breast augmentation affect breastfeeding?
It depends on how you do the breast augmentation. So when you do a transax breast augmentation or through the highest wrinkle in the armpit, the implant goes directly under the chest muscle and pushes everything forward and never touches the breast. So your breast architecture is completely undisturbed and there shouldn't be any impact on breastfeeding. When you make the incision in the fold underneath the breast, you're sort of going around the breast, and so it's very unlikely that you're going to impact breastfeeding. If you do a periareolar incision and then go through the breast, you're going to go through some of the ducts or the hoses that carry the milk out, the pipes that carry it out from the breast lobules. And so when you divide those, the lobules or breast lobules on the opposite side of that are not going to be able to get their milk out. And so you'll have some decreased amount of volume of breastfeeding, probably on the order of about 40% of the volume. But that's a great question.
Definitely. Jackie asks, is breast augmentation painful?
So another good question. Any surgery we do is going to have some level of pain. And so breast augmentations are associated with some pain. And so how do we deal with that? Well, one of the things that we do here is we actually put a 3-day numbing medicine around the implant and around your incision. And that really takes the edge off. And so it kind of takes away a lot of the sharp pain. The muscle will still kind of go into some spasm and you'll feel that tightness in the chest muscle. And so one of the things you can do is kind of bring your shoulders back, because after an augment, it kind of pulls your shoulders forward. And so you can kind of resist that by bringing your shoulders back, stretching out your chest muscle. That will kind of help it relax. But when we couple the breast augmentation procedure with a 3-day numbing medicine, pretty reasonable procedure to go through.
Teresa is a great one. What's the recovery time?
Recovery time, it sort of depends on recovery to do what. So for most people going back to work in an office type setting, it'll be a week or less. To start low impact aerobics will be 2 or 3 weeks. And before you do anything strenuous, it's usually 6 to 8 weeks. And so But the implants go through a process. They kind of start off a little bit high, and then really on an average of about 4 months, might be 1 month, might be 9 months, but on average around 4 months, the implants sort of drop down into place.
How long does a breast augmentation last? From Katie.
So how long does it last? Well, loaded question. It lasts until you have a problem or need to make a change. And so that could be a very long time. The FDA recommends to us that we exchange implants every 10 years. And the reason they do that is because the new gel implants we have really don't run. They're sort of made in a semi-solid. They're kind of like Jell-O. And so it's, even if there is a hole in the implant, it's hard to even figure it out because it just kind of keeps functioning normally. So they sort of arbitrarily told us that at 10 years that we should exchange them. A number of us aren't happy with that number and think it could be a lot longer or shorter. But one of the things that we do for our patients is anybody with an implant, we offer to see once a year, and we'll sort of monitor and check your implant. And sometimes I can feel if it feels a little different that there might be a problem with the implant, and then we can go ahead and investigate that. But it's sort of a complicated answer in that it's until you decide to make a change or have a problem or hit some sort of time limit, and we're worried about a failure in the implant, and then make an exchange at that point.
I think that's a great answer because there's another question. What types of implants do we offer? Stacy was asking.
Okay. So we have really a variety of implants. And so one of the things we talk about is the fill of the implant. And so the most common is silicone, but there's also saline. In our practice, it's I'm not sure we do one saline a year anymore. It's mostly silicone. And the reason why is patients prefer the feel and look of the silicone implants over saline. They seem to be a much more superior feel. And so that's the most common fill of the implant we use. You also have a choice between smooth and textured implants. We're a big fan of smooth implants. I've never really liked textured implants. A lot of textured implants have had problems and come off the market. So I've really never been a fan. You are welcome to come to my office, any of you, and feel in your hands one smooth and one textured implant that has a shape to it, and feel them yourself and decide for yourself which one you think feels better. You have a choice between round and shaped implants, and for a whole bunch of reasons, we prefer round implants. Shaped implants are kind of stiffer to hold that shape, and if they turn, they get a little funky. And then shaped implants have a texture on them, which has a number of, I think, disadvantages compared to smooth. And so the typical, most common implant we use is a smooth, round silicone implant. Also happens to be one of the least expensive, and I think least problematic implants. And so that's sort of been our go-to for a long time.
Would you say, Dr. Ronan, that the silicone implant feels the most natural then? Because that's kind of where Amanda was asking a question.
Yeah, yes. So there's not really a lot of options for fill. It's going to be silicone or it's going to be saline. And so silicone, without a doubt, feels, softer and more natural than the saline ones. And so, those are the softest ones on the market now.
Karen says, can I lift my breast without implants?
Can you lift your breast without implants? Absolutely. So if you have drooping, we do a breast lift. A breast lift will lift the breast back up without an implant. So lifts make breasts higher and implants make them bigger. And so if you need to be higher, then we'll do a lift.
Maylee is asking, can I get an augmentation even though I am breastfeeding?
So we wouldn't want to do the augmentation while you're breastfeeding. The concern is that if you make an incision into the breast and divide one of the breast ducts that's producing milk, it will then keep producing milk, and that milk will collect inside where the incision is. It's called a galactocele. And so that's kind of a painful, not painful, but problematic thing for us to deal with, is to get that to stop. And so we don't really want to make an incision in the breast while you have breastfeeding going on. Theoretically, You could do a transax augment, put an implant in. You're not disturbing the breast at all, and it probably wouldn't matter. But in practice, we don't like to do augments while breastfeeding is going on. We like it to be stopped for probably 6 or 8 weeks prior.
All right, I have another question. What happens if you don't replace your breast implants?
If you don't replace your breast implants, so I'll expand that out a little bit. If your implant's doing fine and you're doing fine, then not much. You just kind of keep enjoying them. If your implant fails or ruptures, so what would happen to that over a period of time? Because I've seen certainly a number of implants that I've taken out over the years that have been in for 30 years, and then we take them out. We know that 20 of them, they were ruptured. So when an implant ruptures, one of the things that happens is sometimes it just sort of changes the shape. So it's not perfectly round. It kind of gets like a funny shape. And so that's one of the indicators that, we might want to investigate whether it's ruptured. Is the shape's a little funny. And when you lift, push on it and examine it, it just feels a little bit different. It doesn't feel quite like a normal one. So if you leave that alone, it'll just kind of start getting to an odd shape. But again, I've seen implants that were ruptured for 30 years and, take them out and redo them, and they do just fine.
I think that kind of answers Maggie Rose's question. She said, how often do you have to replace them?
So we sort of covered that earlier, but it's the FDA recommends every 10 years, but it's if you have a problem or you want to make a change, or we feel like your implant's moving towards failure, then we might want to exchange them.
BJ has a great question. What age is best for breast augmentation?
18 and above. So anyone who's 18 and above can have a breast augmentation. There's not really a best age. It's sort of when does it fit your life? We have patients with circumstances and they're interested in having, an augment or another. Well, today, we had someone come in and set up for a surgery, actually a revisional breast surgery. And then next thing she's pregnant. And so had another child and then another one, and then comes back in, I'm ready now. And so when is it good for you in your life? And when do you want it? And, when are you ready? And then, we're there to help. So there's not any specific age. So.
Perfect. I think this goes along with Judy. What happens to breast implants when you're old?
So that's a good question. What happens to breast implants when you're old, or what do you do when you get old, or all of those questions that we get a lot of times from sometimes some younger patients that are maybe a bit naive, or kind of say, what happens when I turn 45 and I'm really old? Do I take them out or whatever? And we all sort of chuckle as we're getting a little bit older, and we're like, yeah, that's it, 45, super old. But the reality is that you get older and still like having implants. And so patients come in, we've had patients in their 70s come in and want to do a primary augment. We have patients come in 60s and 70s and want to do a revisional augment. And just because you're getting a little bit older doesn't mean life's over. And so if you want to have fun with your life and you want to do things, go for it, as long as you're healthy and it's appropriate, thing to do, for you, I think it's great. And so age doesn't really have to be a big issue.
Cora is asking, should I wait till I'm done having children to have the breast augmentation?
Good question. And so it's sort of a little nuanced. If you're younger and you're not going to have kids for 5 years or so, you might want to get an augment and enjoy them while you're sort of single and young and smaller and whatever, and, have an augment. If you're right about to have kids, might be a good idea to wait. I've seen it both ways. Some patients will do it before and maybe make a little adjustment after kids, maybe not. So it sort of just depends. But if you're going to get pregnant like imminently, it'd be a good idea to wait.
Perfect. Nona wants to know, do breast implants feel heavy?
So breast implants don't really feel heavy. They're actually lighter than water. The silicone implants are lighter than water. And when they're under the chest muscle that hasn't been cut, they're very well supported and they feel like they're part of you and move with you. And so they don't feel heavy. If you have bottoming out or lateralization from a muscle that's cut, a lot of times those sort of feel bulky and like they're pulling and not well supported, and they will feel more heavy. But the way we do it with under the muscle, it typically doesn't feel very heavy.
We have a question from Janet. Hi, Dr. Ronan. You did my implants a few years ago, and I'd like to go bigger. What's the max under the armpit?
We can't really do a big upsize from the axilla. And the reason why is when we put the implant in and your body forms a capsule around it, which is kind of like scar tissue that's thin and it holds the implant in place. When we're going to do an upsize, we need to expand that capsule or essentially make cuts in it, like in a checkerboard, so it can spread out. Now, there's sort of a specific way we do that to preferentially put the expansion maybe towards the middle and across the top and shape the implant. But we're essentially doing what we call capsulorrhaphy to open and expand out the capsule to allow a bigger implant to go in and then still have an oversized capsule space. If we didn't do that and we just put it from the armpit in there, the capsule pocket might be too small for the big implant and it would look kind of funky shape and feel real tight. So typically when we're doing a larger upsize, we need to make an incision on the breast, either around the nipple or in the fold underneath, and get in there and adjust that capsule so we can fine tune the shape and then put in the larger implant.
I have a great question from Adrian. Do they feel real to men?
So another good question. Sort of depends. So I'm a man and I can feel it like instantly in virtually anybody, but I do this every day. But I also have patients that come in here for a revisional surgery who got the surgery before they were married, and they come in and they're like, well, my husband doesn't know I have implants, and this entire time, just doesn't know. And so going to redo them and change them and go home with a surprise, I guess. And so I've sort of found over the years that a lot of men are just kind of thrilled to be around them, see them, experience them, and maybe are a little bit clueless about like what the actual implant is. Sure, some guys are going to figure it out. But it's been kind of funny in how a lot of guys just don't like pick up on it very well.
We have time for one more question, Dr. Ronan. Melee says, what type of pre-op tests are necessary?
Another good question. So if if you don't have a complicated medical history and it's pretty straightforward, we can do everything in the office. So we'll typically do the hemoglobin test here in the office, and that might be the only test that we need. If you're a little bit older, we might also do an EKG. And then if you have any associated medical problems, we might do a few other things. But for most patients that are coming here, we're able to do all of our testing within the office. That's it? That was our last question for the night?
That's it for now.
Awesome. All right. Well, what else we got?
Well, I can share with you our raffle prizes. Tonight's raffle prizes, we're going to have a winner for 1 hydrofacial treatment. We have 1 laser genesis treatment, a $1,000 gift certificate for any surgical procedure. All our winners are going to be contacted tomorrow, so thank you so much for joining us. We have our next episode is going to be Wednesday, April 17th at the 6 p.m. time again, so look out for that. Dr. Ronan, back to you.
All right, we got our special guest. We got our mascot Tahoe, who just got a haircut and grooming and a bath today, and so
he looks so good.
He's like super clean. Mr. Clean, smells good, and had a nice long day kind of sleeping it off here in the business office. But thank you all for coming. We really appreciate it. If you have more questions, please let us know and come by and see us. We'd love to talk to you about breast augmentation or anything else, and say hi to you and let you meet our little friend here. So thank you very much for coming.
I look forward to hearing from everybody. Let me know if you have questions. Contact us. Take care.